Let's talk about timelines after femoral lengthening surgery. The typical timeline looks as follows. Patient arrives for their preoperative consultation, and that happens a day or two before surgery. Then day 0 is when the surgery happens, and that takes about 3 hours for the surgery. The patient will spend approximately 2 weeks in the hospital and then be transferred to the rehabilitation facility. During this timeline from day 0 where the surgery occurred, in the first phase in the hospital, it's about pain control, restoring normal function, and getting to do activities of daily living like showering, going to the bathroom, eating and drinking, and so forth, and also establishing the rehabilitation routine. We typically start the lengthening process itself somewhere between day 10 and day 14 post-surgery, and then we proceed with the lengthening in our femoral patients at 0.75 millimeters per day. That means if we want to get to 65 millimeters or 6.5 centimeters, that distraction phase takes around 80 to 90 days. Once that is complete, the patient then continues with the physiotherapy, but then the focus shifts from lengthening to consolidation and restoration of function. And that process typically then takes many more months to complete. But in a nutshell, at the 100-day mark, where we've stopped the lengthening, the patient then transitions onto crutches in about 6 weeks after the stopping of the lengthening. Once we achieve crutch walking in a safe way, we can slowly start weaning the crutches away from the patient, and that takes another 6 to 8 weeks after that. In a nutshell, this is the timeline that one can expect from femoral lengthening surgery for approximately 65 millimeters.